Hello, this is Dr. Wells with Wells Medicine, and bladder issues have been on my mind a lot lately. I'm seeing a lot of patients come to me with worries about bladder issues, and I think it must have been in the news a lot lately. In talking to these patients, they're not having any bladder symptoms, but they've heard from a friend of a friend, or they've seen somewhere that there are a lot of bladder issues associated with ketamine. And I wanted to discuss this because, first of all, I would never do anything to patients that I thought caused more harm than benefit. And secondly, I really do want to encourage patients to, if they have a concern, whether it's about a private part or something very personal like a bladder or urinary tract issues, to please do bring that to me. I'm happy to discuss all kinds of things about urination, bladder issues. But what we know clinically, and this is anecdotally over the last 10 years of my practice, but this is also from the practices across the country and across the world that I keep up with, and the data from research papers, is that ketamine, as it is administered in a clinical setting, is almost, although not impossible, but almost never the cause of urgency, bladder irritation, bladder ulcers, ketamine bladder, bladder stasis, interstitial cystitis. There is a syndrome called ketamine bladder syndrome, and certain people in the popular press who have abused and used ketamine at home have discussed their own bladder symptoms. And what it's caused by is the metabolites of ketamine are concentrated in the urine, and those metabolites can be very irritating to the lining of the bladder. So the more and the longer your bladder lining is exposed to those irritating metabolites, the more risk of getting ulceration and bladder symptoms over the long haul. Having said that, if you're coming in for treatments and you're getting them 6 times in a row, but then once every 2 to 4 weeks, and at the doses that we use, they're very, very low chances of having bladder symptoms because ketamine is out of your system very quickly. So if you're only having ketamine once or twice or even 3 times a week, that bladder is not being exposed to those chemicals very frequently or for very long. So if you come in and have a ketamine treatment, your bladder is maybe exposed to those chemicals for 6 hours. And after 2 urinations, the percentage of chemicals in your urine is incredibly low and would not be enough to cause those bladder symptoms. We see those in patients who are abusing ketamine on the street, using grams and grams a day, using super huge doses at home over the long term where they're being exposed every day and their bladder is not getting a break to patch up the lining. So it's just a daily use of ketamine. So that's where we're really seeing those problems. But I welcome, any discussion, and I'm happy to discuss all of these things because they're valid concerns. I did have a patient who had actually did have urinary symptoms after an infusion, but when she saw her primary care doctor, got a urine dip, it actually turned out to be a urinary tract infection, and ketamine doesn't cause bacteria to be in the urinary tract. That's its own whole separate thing. So once she was given antibiotics, the urinary symptoms went away. And without discussing it with me, that patient would not have gone to her PCP, would not have gotten tested for a urinary tract infection, been put on the correct antibiotics, and gotten the symptoms resolved. So I am really glad that she addressed it with me so that we could get all of that taken care of and, have it treated in the appropriate, proper way. But everything is always available for discussion. And, each person is such an individual that I really welcome talking about possible side effects because I never rule anything out. But I did want to give reassurance that the doses that we use and the frequency that we use those doses in would be really, really unlikely to cause ketamine bladder or urinary symptoms in general.